So the first reflex that I'm going to do is a suckling reflex. So the suckling reflex is going to be performed as so, and I should expect the automatic sucking motion when lips are touched, and the negative result is going to be absence of sucking motion when lips are touched. This should disappear around 4 to 6 months. The next thing I'm going to do is a rooting reflex. So I'm going to take my hand and then go across, and we should expect for the baby's head to go towards the side in which we touched. And a negative result is going to be lack of turning head when touched on the cheek or mouth. This should also disappear at 3 or 4 months. The palmetto will be with the hand. If I go like this to the hand while raising across the palmar aspect, we should expect puckering of the lips to occur. A negative result is going to be no contraction of the mentalis muscle when the palm is stroked. This isn't well defined and can diminish through age throughout life. The next thing that we're going to do is something called the glabellar reflex. I'm going to tap the patient's forehead, and I should expect the patient's eyes to blink. A negative result would be no blinking response when the forehead is tapped, and this usually disappears about 3 months. Tonic neck muscle, I'm going to put the patient's head in a position such like so, and then turn the patient's whole body is going to turn left. We should expect tension of the arm on the side the head is turned to, and then flexion of the opposite arm. And then a negative result is going to be no distension when posturing when the head is turned, and this should be disappearing around 4 to 6 months. Next, we're going to do snout reflex. Snout reflex is going to be puckering of the lips in response to light pressure on the philtrum. So as I press here, there should be puckering. A negative result is going to be absence of puckering on the lips when there's pressure on the philtrum. This usually disappears around 3 to 4 months. Next, we're going to do the Moro reflex. The Moro reflex, I'm going to put the patient up into extension and then just lay them down. And what this is going to be extension and abduction of the arms followed by flexion and a deduction. The negative result is going to be absence of the reflex or incomplete response. This typically disappears in the 3 to 6 months. Next, we're going to do grasping. Grasping is when I put my finger on the patient's palm, and we expect their palm to grasp onto my finger. A negative result would be lack of grasping or weak grasping of objects. This usually disappears the 4 to 6 months. Next, we're going to do a leg length check. This is going to indicate, this isn't a specific reflex test, but for the possibility of congenital hip dysplasia. So how this would normally be done on an infant would you would have a measure, and you would measure the from the top of the ilium all the way down to the calcaneus bilaterally, and then you would compare size. And if there's a huge discrepancy, this may give insight on future hip pathology or dysplasia. Next, what we're going to do is we're going to do the Barlow maneuver. Barlow maneuver is going to be used to find possible hip dislocation pathology or hip pathology or dysplasia. What we're going to do is we're going to adduct the leg. What we're going to do is we're going to adduct the leg, and then we're going to add a posterior load to the leg to dislocate it. And then what we're going to do ortolani's, which is we're going to abduct and then lift anteriorly to relocate. And so we're going to do this bilaterally to see if the baby is more prone to hip dysplasia or hip dislocation. And that's it.